Morning, everyone.
Good morning.
How are you this morning?
Good. How about you?
I'm doing all right. A little frustrated. Um, I'll talk about it here in a little bit, but um, we just our judicial system and it's just leaves much to be desired. I'm
Yeah.
trying to help some guys, and it's just so many hoops and barriers and regulations. It just makes it difficult, but I mean, we'll try to figure it out. But um, yeah, just kind of frustrated. I got some news on a couple of guys that I'm trying to help, and it's just a lot of red tape, a lot of regulations, and all this and that sort of thing.
Yeah, that can definitely be frustrating.
Yeah. D. Anthony. Trying to remember who that is.
From
I'm trying to.
Dismiss Charities.
Yes, I know it was just Miss Charity. I'm trying to remember your name, your first name.
Dayana.
Ayana. Okay. Good morning to you.
Good morning.
How are you? How's everyone doing at Dismiss Charities? And Jim doing?
Pretty good.
That's good. You guys, are you like have a lot of do you have a lot of capacity, or are you full, or
We're not full. I think we can hold in-house like 68, and then out of house we can hold more.
okay? Are you guys certified by WAVAR and OFLAC and all that?
I have no idea, but we don't do any counseling here. All our counseling is contracted through the BOP. So they go to Counseling Connection.
Okay.
So like get drug and alcohol, mental health, or like sex offender counseling.
Okay. Yeah. Um, yeah, I'm just running into a lot of uh, regulatory barriers for guys that are trying to get home plans. And so you say you don't deal with home plans, those that are just discharged, or that maybe they're not on supervision.
They have to be referred to us by like the Federal Bureau of Prisons,
Oh,
or by, if they're on federal probation, their probation officer can refer them here.
okay. So it's basically federal. Okay.
Yeah, it's all federal.
Okay. Yeah, I forgot about that. That's totally different than what's going on at the state level.
Yeah.
Okay. I just want to make sure we have everyone on, and I'll have I guess maybe another minute here, and let me see. Um, I see Brooke, you're with us, Brooke.
Yep, I'm here.
Okay. Uh, yeah, I was hoping there was somebody else that would be on. He might be on here shortly. As I was explaining, just to it, I I get a lot of individuals who are incarcerated. I've got several that I am in communication with through an app called Getting Out. I don't know if anyone is familiar with this app. It's a way in which you can communicate with individuals who are incarcerated, and through text messages, and also you can arrange to have video calls as well. And it's a very useful app. And I've got probably a dozen or more contacts of individuals, who are incarcerated. And some of them they've been granted parole, and they don't have a home plan. Some of them have difficult charges that make it difficult to place them. But then there are others that have issues as well, that have their own specific difficulties. And so I've been trying to help 3 guys get home plans. And it's kind of frustrating. And, maybe we can talk about this at another time in greater depth. And maybe even try to determine how we can address it by, making it understood by the legislature. But about a couple of months ago, I had a place for them. Both of them were accepted. I talked to them, and we got acceptance letters from the organization. It was for treatment. And so I sent it to the correctional facility, and they received it, and then they sent it to the parole officer here in Kanawha County. The parole officer, did an investigation. I don't know what they do at that point, but then they denied it. And I called them and asked, what was the reasoning, and they said, well, it's approved by OFLAC, because I that much I knew. And he says, well, it has to be long term. The parole office cannot accept treatment facilities or plans that are less than 6 months. So it has to be 6 months or more. And the facility that I had got approval for to accept these 2 guys was only for 3 months. So I started looking around for some long term. And I don't know if John Kango is with us. I had asked if he might be able to be on, but last month he contacted me and let me know of a long-term treatment center. And so I called them, and I let them know who they were, and they could only accept one. They said they would accept one. Another person they just could not accept. Anyway, I got an acceptance letter from them, sent it to the correctional facility, and I just found out about 45 minutes ago that they're not going to be able to accept that place either. And they didn't give me a reason why, but I suspect the reason is that they are not certified by OFLAC. That would be, so I'm back at square one, and it is so frustrating that the state seems to be content with keeping guys and ladies incarcerated, as opposed to addressing some of the issues of allowing some of these facilities that are good facilities. I've been in some of them that simply cannot get past the certification process. And I don't know all the ins and the outs. I talked to one organization. They told me that they tried to go through with and they found that it seemed to be very micromanaging. That some of the things that they were requiring that has to be in place is a judgment call in their opinion. I don't know. I'm not speaking as an expert, but all I know is in speaking to one owner of a facility that could not pass with they just said that it seemed like they were trying to tell me how to run my business, and I don't know anything about OFLAC. I tried to get one that was OFLAC approved, and it was, but it has to be 6 months according to the parole office. And I talked to the parole officer, and they said basically we can't take any chances, and I understand that. They don't want to run the risk of these guys, and the facility that I got them approved to they said that, well, after the 3 months, we will transfer them to other programs so that they'll continue to get service and you know, be helped. And the parole officer indicated that, well, there's not a lot of places that they can be referred to. Um, you know, you have one place that they could go.
I think he froze. Brooke, I see you moving, so
Yeah.
yeah,
John, I think you froze.
yeah.
Sorry.
Don, can you hear us?
Oh,
No.
I'm sorry,
There you go.
I got disconnected. That was all of a sudden too.
Yeah.
So and just it's just very frustrating because I've got 4 guys that are incarcerated. They've been granted parole and they have no home plan. They can't get out. Um, and you know, a couple of them have some serious charges. But and one of them is going to be discharged, but he won't be off parole. So even if you discharge, meaning that you fulfilled your sentence, you have completed your time, but you're going to be on probation for a certain length of time, you still basically have to jump through the hoops of the state, and so that's where we're at. So and I know, you know, I've got several that I know that are granted parole, can't get out, and I know that there's hundreds others like him, and the state seems to be content with allowing the state to spend the money to keep them incarcerated, as opposed to spending less money to get them out. And that's one reason why we have such an overcrowded prison system. So I'm venting here, uh, and please forgive me, but that's where we're at. And so it's just kind of frustrating, and I don't know what I can do. One of the guys has texted me back and said, you know, have you heard anything? And I'm going to have to tell him the bad news. And it's demoralizing. And so I don't know. I'm going to have to, I think the best thing I can do is to go on. I'm going to talk to someone and see what are the OFLAC approved places, and see if I can talk to some of them and see if they're willing to accept some of these individuals with the certain charges that they have. That would be the only thing that I can think of right now, and because I feel like I'm spinning my wheels, and I might as well just simply go to the places that the state has approved. But I don't know, you know, they're few and far between, and I don't know where they're located and that sort of thing. So that's where we're at. That's, you know, and it's not just West Virginia. I'm sure it's in other states as well. I don't want to sound as though West Virginia is unique. It's not. So, but in any case, I want to just welcome everyone this morning. Glad to have you with us. And is there anyone that this is the first time you've been on this particular reentry council that maybe you want to introduce yourself, or maybe this is first or second time?
Hey, my name is Sam Kingston. I'm with the Samaritan Inn here in Charleston. Uh, I put my information in the chat for you. We work with everyone. We have a bunch of beds open right now. So I put my cell phone number there and my email. If you want to reach out to me, I can send you our application.
Yeah.
If you give the guys my information, tell them just to get connected with a case manager at the facility they're at, and then have them reach out to me. I'll set up an interview with them this week or next week. If what the only things that we can't really accept is sex offenders,
Mhm.
but you know, we're open to accepting, or we can accept anything else. And I always set up a first interview, you know, no matter what, because I want to talk to them and see where they're at. So, if you want to, my information is in the box. I don't know if you lost it or not, but
No, I
when,
have it.
okay, yeah,
Were you on last month? I think
no,
I've seen you on
maybe
before.
I may have. I
You
do a
weren't
lot of
on,
these.
okay. You weren't on this one last month. I'm looking at the list, but I
All right,
think I've
yeah,
seen you on this one before, maybe a few months ago. But let me ask you, yeah, are you certified by the state facilities? You know, whether it's
yes,
WWA or OFLAG?
yes, yes, yep.
Are you like a long-term treatment?
Yeah. So we ask that a commitment of 6 months at
Okay,
least, but they're welcome to stay up to 18 months.
okay,
We're level 2, so there's a lot of freedom here. You know, staff isn't on premises at all times.
mhm.
Uh, you know, but we're available 24/7. So even though we're not here, I mean, they can call us anytime, and I mean, I'm on call 24/7 for whoever needs me. But um,
Do they have to have sud issues?
yeah, yeah,
'Cause
that's
I have
another thing. Yeah,
Yeah, that's fine. And there's almost everybody I'm dealing with has that.
yeah.
I'm dealing with suds as well as sex offenders. Um, but I do have some individuals that are coming up for parole. Actually, one just had a parole hearing. I don't know what the results were. I haven't talked to him yet, but I don't think he's a sex offender, but where are you located? That's the other thing.
1117 Coyer Street here in Charleston. We're like
Oh, okay.
5 minutes from downtown.
So you're in Charleston.
Um, yeah, Charleston. Yeah, I know.
I have an individual who's I think he just had a parole hearing, or he's going to have one here coming up. I think he does have suds issues, but I don't think he's a sex offender. But I'll have to double check because I my memory's not as strong as it used to be. But um, but I have your contact information. I definitely want to talk to you and maybe um, I have visited some of these places and I definitely like to do that as well.
Oh yeah. Come
Yeah.
by. You set up. You want to come by and check out the house? It's a beautiful house. It's a beautiful house. And the guys here super welcoming, and from what I've seen, guys they get jobs. You know, within the first week they're here, and we're 12-step base, so
Yeah.
we don't have a lot of expectations here. You know,
Okay.
uh, but the expectations, I guess, they're high expectations. Just pretty much just a job. Go to meetings, and then the staff is here just kind of guide you to get you where you need to go.
Okay.
So
Well, I appreciate that, Samuel. Really do. Uh, One of the things that we've been trying to do is put together a directory. We had a directory and it's outdated probably. It's been probably a couple of years, but this quiz is a lot of new programs that have come up and so you know, it's good to know all these different resources. And John Kangas gave me a resource that I reached out to, but unfortunately they were not OFLAG certified. But so we need to know more and more of these facilities and that sort of thing. So I appreciate that, and I got your contact information, and I may be in touch for sure.
yeah, let me know if you want to come by and look at the house.
Yes.
I'll set something up with you. I'm here all week. I can come in on the weekends. I'm open availability. So whenever if you'd ever want to come by and check it out, let me know. I'll give you a walkthrough.
All right. Thank you so much. I appreciate it.
You, you're welcome.
Anyone else?
Yeah, John, kind of along with what you said with the resource list, I put in the chat a Google sheet. So we have a new Google sheet that I've been using to collect information from everyone. So if you can put it in the chat, but also go over to that Google sheet and put it in, and then you can click the tabs at the bottom. So if you serve them more than one region, You can have, your information will be there. And then that's, it's a live document, so we can go in and update it. Everyone can save it, bookmark it so that you have resources across the state. So, so hopefully we can keep it a little more up to date and a little more live than 211 or
Yes.
West Virginia or something like that. So,
Right.
it's up at the beginning of the chat, but I can drop it again if anybody else needs it.
That'd be really good. So, well, thank you, Samuel. I appreciate that. Anyone else? All right. If not, I'm going to, Brooke, do you need to share your screen?
Yeah, if I could.
Yes, let me. But Krista, Krista, do you want to do that, or do you want me to do that? I'll make
I
you,
should be able to. Hang on, let me see.
yeah, I'll just make you host, yeah.
Okay.
Um,
Mm,
okay, you already got it? Okay.
yeah. I wanted to ask, what was the name of the app that you had just mentioned?
Getting out.
Getting
It's
out.
it's a very and Krista also can speak to this. And before you start, Brooke, I do want to also mention that next month, because I don't want to forget this, but next month is the second month second chance or second look month. What am I correct on that, Krista? Second month. I know we did this last year. And we want to just highlight next month individuals and um, people who can share their stories of how they've overcome, how they have, you know, gone through incarceration and substance abuse issues and have really come through and have great success. And we had an interesting speaker last year in April. So it's usually every April, the month of April is designated for that. And so we're going to have a guest speaker who has really come through and overcome the challenges of incarceration and substance abuse and that sort of thing. And we may have some others as well besides that person, but we'll have some speakers to speak to that. And I think it'd be interesting to encourage. It's also encouraging. So, but the app is called Getting Out. And I was talking to Krista about maybe even having a month where we can talk about that because it is very important. It allows you to get in touch with, I have not only individuals that I don't know and have never met in person, but I have a couple of people actually three people. One's a member of my family, and I have two that are members of my church. And so it allows you to have text messages with them. It also allows you to have video calls with them. You have to put money on there for your account to be able to send messages back and forth. And it doesn't take a whole lot, $25, because the text messages is only like 15 cents per message, and each message can go up to 1,500 words. And then video calls, I think, are something like 40 cents a minute. So it's a pretty nice app.
Thank you. I appreciate it.
Okay, Brooke.
Okay. So I'm going to introduce Tasha Withrow and Cassie Province. I have COVID. Sorry, I sound like this. So Tasha is, Tasha, do you want to introduce yourself? You're going to do a better job than I will.
Yeah, sure. So my name is Tasha Withrow. I am from the Department of Health, the HIV prevention team. We do testing, outreach, education related to HIV prevention, and we're trying to get involved in the recovery spaces, reentry spaces, and that sort of thing. And yeah, and we work a lot with Cassie and Brooke at Ryan White, and we try to coordinate our efforts as much as possible.
Thank you. Cassie, you want to introduce yourself?
Yeah, I'm Cassie Province. I do early intervention with Ryan White. So I'm in the hospitals, getting people when they're first detected and getting people in care that we have lost. I also work with Brooke hand in hand, and we do a lot of outreach 3 times a week. So we're in the community a lot. I also has been given the task or opportunity, one could call it either way, of helping with the reentry for people with HIV also. So trying to get a handle. I think this app thing would be very good. That's why we were asking about that. I think if we could, get a handle on what someone's HIV, how they would like their HIV care to look like outside when they get out would be positive. Before they got out would be even better. So we wouldn't have to hunt them down. We would actually know where they were. So yeah, I'm excited to be on here. Thank you all.
Thanks. And I'm Brooke Parker. I'm a social worker with the Ryan White program at CAMC. And if you don't know much about Ryan White, then we're a federally funded program. Ryan White's in every state in the nation right now, and has been for a long time. And we provide all of the like specialized care for people living with HIV. And the big piece of Ryan White funding and the purpose of the program is to make sure that everyone has access to medication no matter what. So we have people that have private health insurance and their copays for medication are just, it's ridiculous. It's thousands of dollars. And so we have a program called the AIDS Drug Assistance Program that covers the copay cost and a lot of the medication cost if it's needed for people that have private insurance or a gap in their insurance. And then our clinic part, the Part C program, is it's our clinic-based program. And so again, it's in every state across the country. It doesn't matter where people go; they have access to it. If you're living with HIV, that's always something you've got access to. And the doctors that work for Ryan White programs are HIV care specialists. And with most Ryan White programs, also there's medical case management, and so it's our like different pots of money under the Ryan White umbrella, but medical case management is one of the big pieces of it. I'm the linkage to care coordinator for our program at CAMC, and we cover 19 counties. So Cassie and I both came on at the start of the outbreak, and Cassie worked for a different company in the community, but we figured out pretty quickly that the approach that we were taking to our outbreak was just not working. Like the medical approach, a very standard like medical approach, just wasn't working for this population because lack of access to healthcare, a lot of medical mistrust in the community, and just people truly not knowing where to go. It was right during the pandemic also. So education about this HIV outbreak really kind of got squashed by COVID. So there wasn't a lot of education about it. There's very, very little information in the community in terms of education about risk factors. Hepatitis C also is right. We know that we've got pretty huge numbers of hepatitis C in the state. I mean, it's all across the country, and a lot of the HIV outbreaks are happening in Appalachia. So it's really small communities where there's high poverty, a lot of drug use, and lack of harm reduction programs. This is where we're seeing all of this happen, and that's countrywide. So we do see a pretty significant concentration throughout Appalachia. And so we had that outbreak in Huntington, right, a couple years ago. Our outbreak in Kanawha is definitely getting better. The approach that we've taken has been really successful, but we also know that there's still smaller pockets of clusters like HIV clusters where it's a number of people living with HIV not in care necessarily, or they don't know that they have HIV because there's very little access to testing. So that's what Ryan White does. It's a little bit about our outbreak. And then, so in response to an outbreak, the CDC comes in and does what they call an epi-aid. And so it's like epidemiology. And CDC comes in, we had federal CDC workers here for, oh my Lord, it was a long time. It felt like, was it a summer, Cassie? Was it a year? It felt like 10 years.
It was about 6 months at
It
least.
was so long. The feds were here for so long. And a lot of the gaps that we identified.
Was it really that bad, Brooke?
Oh my golly. It was like traumatizing. We're all like,
It's like having the military look over your shoulder the whole time you're trying to find people.
well, and it was really interesting the approach that like surveillance, like public health surveillance takes, and especially in an epi-aid or in an outbreak situation where the risk to the larger public health is that's the concern, right? And so the strategies that they tactics is probably a better word. The tactics that they use to find people went against everything that we kind of know about how to care for people who are using drugs, or people who have drug use experience, or people who have a history of incarceration or justice impacted. There was not a lot of privacy. The way they go about a lot of these investigations is just, it can be really harmful. So what we learned out of it, though, is that the relationship that we have with our community members really hinges on people with lived experience being involved in the community, right? So like for the majority of our outbreak, about half of them were identified in the hospital system through people like Cassie and our early intervention team advocating for people to get tested. Because just because you sign that box when you get admitted to the hospital that says, yes, I consent to HIV testing, does not mean you actually get a test. You sign it at doctor's offices, you sign it at the hospital. It's state legislation, but that does not mean you have gotten an HIV test when you go in. That's typically something you have to really specifically ask for. And then even then, you don't always get the results from it. There's a lot of reasons why someone wouldn't get results given, right? They leave AMA, the doctor just never followed up with them. No news is good news. And so what we designed early intervention to be is, so we've got a specialist coming in and talking with everyone who has risk factors for HIV. And talking with them about harm reduction, education around the risk factors, how to reduce risk, where to go for help, where to go for testing, where to go for care, all of it. And so we did diagnose about half of our outbreak in the hospital system. And then the other half was in the community, and it was through community-based outreach, street medicine, rapid finger stick testing. So it's about half and half. So we know the importance of it. And the main way we were able to get as many people into care as we did is because of people with lived experience. There's a lot of our patients advocating for their friends to go get tested, or just the relationships that we've been able to build throughout Kanawha County with other outreach workers. And so that's how we were able to make progress with it. So EpiAid, after an EpiAid, what happens is a state has to come up with an elimination plan, right? That makes sense when you've got an outbreak like this. So CDC requires it. And so this elimination plan was written in 2023, I think. Right, guys?
Yes.
23. 2020. It was published in 2023, whatever. So West Virginia decided on a syndemic approach because of hepatitis C, viral hepatitis, and HIV, and it is rooted in the opioid epidemic. And so every elimination plan also has 4 pillars generally. We'll start prevent, right? So prevention of the spread, diagnosis, because people have to be diagnosed, treat, people have to have access to treatment, and doctors have to be educated about how to treat, and then respond, and that means to the overall outbreak. And so Tasha and Cassie they're the co-chairs for the Prevent Task Force, and I'm the chairperson for the Diagnose Task Force. And where we really see a gap in a lot of the planning around this has been really lacks people with lived experience sitting at the table. We don't have, Tasha and Cass, if you want to jump in, go for it. But we don't have good representation of people with lived experience, people living in the problem, the experts on the problem informing how we go about this work. So a lot of our goals as a team of people is to make sure that we do have people with lived experience sitting at these tables, and planning the work and helping to execute and informing also of what's working in their communities and what's not. So Tasha, is now a good time to talk about what you've got going on with reentry?
Yeah, sure, I'll go ahead. So when it comes to reentry and the justice involved population, that's one of my focus areas. I focus on justice involved folks and people who use drugs. And so for the justice involved folks, I have been trying to create quite a robust program. I want to catch people while they're still incarcerated with training and education, and then I want to catch them when they get released as well. So Brooke has joined me before already. We've been doing some training at facilities This training includes STI training, HIV, harm reduction, hepatitis C, and we went into Parkersburg Correctional, and we were able to take a couple days with the gentlemen that are in there, and just did a like a PowerPoint presentation, spoke with them, talked with them, and they asked questions and that sort of thing, and it went really well. They enjoyed having us there. They said that they learned a lot, and so that's something that we're going to keep going. Something else that we're trying to get off the ground is getting supplies to reentry specialists, and that can look like HIV take-home testing test kits, and even some of the other supplies that we offer, which is like wound care and safe use supplies. I know that when you're with a reentry specialist, a lot of the times the expectation is that you're sober and you're not using, but we still like to have these supplies available to people just in case, because it's better for them to have clean equipment than to not. We're in the business of preventing the transmission of disease. So, but the one thing.
Can I ask a question,
Yeah.
Tasha? So, these are individuals that are you're talking about those who are incarcerated presently, and they're, I guess, maybe going to be released at some point. Is that, and that,
Yes.
and that that they have either Hep C or HIV?
Or they're at risk. Yeah.
At risk.
So, yeah. So we want to catch the people that are living with HIV or Hep C, or are at risk.
How do you determine that, the at risk part?
So that's where the other part of the program comes into play. We're wanting to catch people when they're getting booked into a jail, and they're off. Hopefully, they're offered testing at this time. I know it's not always happening, but let's say, perfect world, they're offered HIV, Hep C testing when they're booked into South Central, and they can either say yes, I agree, no. If the nurse then tests them and they're negative, but they have risk factors such as substance use, unprotected sex, anything like that, then what we're going to have is we're going to have a referral linkage to care program for reentry specialists to be able to catch these people, whether they're at risk or living with HIV. So when they're released from jail, they can get automatically connected to services, whether that looks like regular reentry services, like just, like they would help just a regular person reentering into the community, or if they need like actual HIV medical care, we would get them connected with Ryan White. So this is something that we've already spoke with them. Oh, go ahead.
Tasha, let me ask you, does that
Yeah.
mean, do you know if the correctional facilities are required to do that, or is it just hit or miss?
Yeah, from my understanding, it's hit or miss.
It is. So we're only talking about the jail system then, because the prison system has a very different way of dealing with testing and diagnosis and linkage to care. The prison, because people are there for so much longer, then they do for the most part, like definitely there's very, very few people I think that get missed in the prison system. But when
Okay.
people are just in the regional jail system, they're offered, the policy is, because I've met with Dr. Amjad and people from Wexford. I've met with them a couple of times now, and the conversation that's come out of it is the policy. And we know that there can be policy, but the execution, there's probably going to be a lot of problems with it. And because of the turnover in the regional jails, then
Yeah.
it's really hard. I know it is, but we
Right.
could also do a lot better.
Right. Okay, I got you.
The policy is that they're supposed to they're offered testing on intake, which for most people is not the ideal time to say, you've just been brought to South Central. Do you want to get tested for HIV? Like they don't get a lot of testing done, right? It's not incentivized. People aren't in the headspace to consider whether or not they're ready to receive a positive diagnosis. It's not a lot of counseling that goes along with it. Counseling meaning like supportive counseling, or like the ability to actually sit and talk about it.
Right.
People, it's just not the ideal time. So the ones that do consent to it, which isn't a lot, might get their results, might. But it's a nightmare from what we've seen in the community. Like we've got a good example of a kid that was tested in the jails, and somewhere in it he was confused and he thought that he had been diagnosed as positive for HIV. I tested him so many times. We drew labs on him. We've drawn labs on him 6 times. He has hepatitis C. So there was some confusion, right? It was a rapid test, but there was some confusion there where he truly thought that he was like going to die of an AIDS related complication. He was terrified. He was terrified to talk to anyone. His mom found me at an outreach event and was like, I think my kid has HIV. Can you talk to him? So we got it sorted, but that happens pretty frequently where people leave the jail, they have a positive test, but they don't necessarily know what it's for, and they assume it's HIV, or sometimes they think it's Hep C and it's actually HIV, or they were never told. We get their names. So the way, if someone's tested in any kind of facility, that positive, the person's name, all their information, that referral goes to the state, and then that trickles down to disease intervention specialist workers, and then it usually comes back to one of us, and we're charged with trying to find them.
We also
So-
just had, sorry to interrupt, we also
No,
just
you're
had
good.
that happen with treatment of syphilis. We had a girl who tested positive for syphilis and she thought she had the whole treatment. We retested her, we ran her labs, and she needed treatment again. The jail didn't treat her correctly.
No.
So she still was active with syphilis and had no idea. So this is an ongoing problem.
It's like we've gotten away from calling them STDs because diseases don't really sound like they're treatable. We call them STIs for infections now, so sexually transmitted infections, because they are all treatable. A lot of them are curable. So with STIs, we see a lot of undiagnosed sexually transmitted infections coming out of the jails, and people just have no idea. With Hep C in particular, there isn't a lot of the nuance that goes along with determining whether or not someone is eligible for treatment, right? Because we know that the sobriety requirement for hepatitis C treatment was removed by the legislature a few years ago, but having a viral load that's high enough to treat is something that you do have to have labs for. You got to talk to a doctor for. Hep C treatment is really, really easy. And since they have removed the sobriety requirement, that's another piece that people just don't know. We don't have great communication between, like our public health system and the people that need the care. So, and with HIV, because of the stigma that's involved with it, right? Especially in Southern West Virginia, HIV is still very much seen as like a gay man's disease, or with the LGBTQ community. And the population that we have affected now, for the most part, are they're people who use drugs, and mostly straight. And so a lot of the complications that we found in the community is just people don't want to talk about it. And what we've watched happen is, if there's peers that are working in the jail system in particular, or peers that are working in the community that can learn how to talk about this and how to talk about risk factors, and let people know Hep C is still sexually transmitted. People don't know. People have no idea how HIV is transmitted. They think that because they're not a gay man, for instance, and they're not at risk for it, and it's just a lack of education. But what we see happen in the jails is Wexford is trying to implement a program where they offer testing again when people are put into the MAT program. But that also takes, someone has to be in the jail system long enough to be eligible for that program, right? So that excludes a lot of our people, and the number of people that are in and out and in and out and in and out of jail that are living with HIV and aren't offered treatment is really concerning. And the policy says that people, if they are testing positive in jail, they're supposed to be linked with an appointment and a couple days. They're supposed to be started on meds while they're in the jail, ideally. We know that there's problems with that, and for totally understandable reasons. But people that are in a longer term jail sentence do typically get offered it more consistently. So there is a lot of problems definitely with the jails, but I know that Wexford's really committed to working on it. We just got to keep on them about it. So that's the background with that.
Yeah, we're basically just wanting to catch people that are falling in the cracks, and I'm sure that we'll find some weaknesses, with what we're trying to do, and we'll be able to, evaluate that and fix it. But we're going to try to get them referred to someone before they're even released, and provide them with information for that person so they have it in hand when they leave the jail.
Brooke, why would there be difficulty getting the test results, or I think you said something about they may not even get the results? Is that what you said?
So a lot of times if it's a lab draw, then people aren't seen again by medical that quickly. The approach, I'm sure, to go to medical, and people either don't want to go, it's not a good time. They've they've realized, like, I don't want to go to medical and know the results of that test. There's a number of people we've talked to that are like, we know it, we don't get tested when we go in because we already know that we're living with HIV and we're not in care. We don't want to talk about it in jail because there's an element of safety, obviously, that people they don't want to know that, and they don't want it out. They don't trust that confidentiality is going to be respected. They know that they could very much get hurt
So
because of
when
the
you
stigma
say
that's
when
so
you say they
attached to
don't
it.
when you say they don't get their results, I thought you were saying that
Oh no, I mean, they just don't get their results either. They get discharged either before before the nurses have
Oh,
tracked them down.
okay.
People get released a lot sooner than they're anticipated. Sometimes they're there for a lot longer than they anticipate, but most of it is just like, it seems like medical and the patients themselves are just getting, they're just getting missed. It's
Okay.
not, seems like a lot of like larger system problems, but a lot of people, I can think of a handful of people just off the top of my head that were diagnosed in the jail system, but we had to find them in the community to give them their results, and they had no idea.
Wow. That's crazy.
So continuing to work on that has been really good. I have hopefully a good relationship with Kanawha County work release, starting with one of the peer coaches that's there, and him doing some testing while he's interacting with people on work release, because they are integrating back into the community. But getting people linkage to care is nothing more than making sure that they know where to go for a doctor, they have an appointment, their Medicaid is good, and they can get medication. That's it. We can help with a lot of the social aspects, and a lot of the support that people need if people are enrolled in Ryan White. But if they don't want to be in Ryan White, it's totally fine. They just see a private infectious disease doctor. It's easy, it's easy enough to arrange. It's just people do have to know where to go. And we do try really hard to make sure that our patients end up with people that understand the intersectionality of the issues they're experiencing, and they understand how drug use and justice involvement impacts their care. It's one of the bigger things that we see. I know we've only got a few minutes left. We've implemented like kind of a pilot hepatitis C program to treat people living with hepatitis C via mobile medicine in Kanawha County. I can get some more information out about that. It's open to anyone. Ryan White only typically serves people living with HIV, and we work on their partners and their friends, of course, but expanding through this hepatitis, it's a viral hepatitis grant through the state. We've been able to serve a lot of people that we wouldn't traditionally be able to serve, and we found that the community access model is a lot. It's obviously more accessible. And the other thing is, we can, if people are interested in learning more about learning how to do rapid finger stick testing for hepatitis C and HIV, Ryan White can facilitate that. We have a small program that we've run for a couple of years now, where anyone who's interested in doing it, we can put you under our CLIA waiver. It's like a clinical lab waiver that you have to do any kind of rapid testing in the community. But we're happy to work with people to figure out something that's going to work for your organization, so that you are equipped to do more of that testing, and you're equipped to counsel people through that process and get them linked to care. So if anyone isn't interested, in the chat, I'm going to put the link to the elimination plan. If anyone is interested in it, it's like 300 pages long. The plan is actually like halfway through it, and all of our contact information if anyone is interested. But the big goal, I know, for us, is just making sure that this elimination plan and the task force work is open to people that are experiencing the problem, people that are living in the community and working in their own communities, and understand the problem a lot better than people in leadership necessarily do. So I have a task force meeting coming up this afternoon at 1 o'clock. I know it's short notice, but I'll send that link out to you if that's okay. You can pass it on. And then Tasha and Cassie have theirs coming up on March 31st. And we can send those calendar invites out too if anyone is interested in joining. No commitment, just come and hang out.
Mhm. Yeah, that sounds interesting. And I think there were some that, and really there were some people that are not on today that would be nice for them to know
Mhm.
exactly what you just said and that this program. And because there are some that I know that they've been on this council, several times over the years, um, and I talk to them quite often that that's something that they probably would be interested in.
We know how much power lives in the people that are on the ground and doing this work. And that's a
Mhm.
part that's really just poorly represented for the task force as a whole, like the whole plan. They recognize the need for it in the plan, but facilitating it just isn't in, it's not in their wheelhouse. So Tasha and Cassie and I are really, really committed to making sure that people have access to this because the planning is really important, and we hope to make a huge dent in
Mhm.
how we change this approach with folks like you.
Mhm.
That's all I've got.
Okay. Anyone have any thoughts, any questions for Brooke or Tasha?
Brooke, I just want to, you and Tasha, thank you for sharing your information with this council as well. We've talked on other, separately, and we've talked in other councils, but, if you want to present at more councils, just let me know.
We would love to. This is such an awesome group to be able to work with because of you guys have an awesome reputation. Just the work that you do is pretty widespread. So we have a ton of respect for you. We'd love to partner up.
Yeah,
And I know it doesn't sound so much like we do stuff that with reentry, but we really do because
Really
with
do.
with people living with HIV and AIDS, they have housing options that other people don't have, and a lot of people don't know about. So there's a program called HOPWA that's housing opportunities for people with HIV and AIDS. It's ran by the Covenant House, but it really opens up. It doesn't. You can be a sex offender. You can have 1,000 charges. You qualify for that program if you have HIV and you have low income. So that is a huge thing to help with people. And then with Hep C, treatment alone is helping people when they come out of jail because the treatment alone, they don't understand how tired they are, how fatigued they are, how malnourished and things that they actually are until they get treated for Hep C. And then it all comes to light. They're like, no wonder I've been sleepy for 7 years. No wonder I can't, concentrate. No wonder I get sick so easily. And they just don't understand it because they're just not educated on the fact. And they also think that if they were going to use again or if they were still using, that they wouldn't be eligible for treatment. And now you are. So 6 to 12 weeks of antibiotics. It just depends on your level. And you start living a new life. I've watched people get treated and cured of hepatitis, and their outcomes are amazing.
Cassie, let me ask you that you're saying that the Covenant House located here in Charleston, um,
Has a program that can go up to jails, sign people up, and get them started on helping for housing. They can pay first month's rent and deposit. They can pay bills for up to 147 days a year. That's yearly. That's from the first day their bill is paid until the last day, like on the bill. You know what I'm saying? Like the bill range. They help people with clothing. They help people with furniture. They help people with, a whole lot of things. It's just hard to get them signed up because of not knowing when they're getting out, right?
so but it sounded like you said that they have to have HIV or
Yeah, HIV or AIDS, if they have HIV or either one, but it's
what
called
about
Housing Opportunities for People with HIV and AIDS. It's called
okay.
HOPWA, and it's in every county in every state.
Now that it doesn't include hepatitis C.
No.
And what's the acronym again?
HOPWA, HOWPA. And if
Okay.
you and that's just, I know not Actually, it's more than you think, and it's a good question to put into your intake if you've ever
Right.
been diagnosed or tested for HIV, because if they get tested and you can advocate for them to get tested in jail, and if they have it, then they get more help. I mean, it's not a prize, but it's a resource, you know what I'm saying? And people don't understand how much help it actually gives. I used to run that program, and when I did, I helped a lot of people coming straight from jail. Because I mean, it's a first month's rent and deposit, if nothing else. You know what I mean? And they can pay for fees like in like sober living houses, fees for like Samaritan Inn. They can help pay them starting fees that people have troubles paying to get into these places, just to get them out and get them. And the whole reason for this program is to keep people healthy and housed. That's what it's for.
Okay.
We
Okay.
know how much housing is linked with adherence to treatment. We know the only way to keep HIV managed is to make sure that people have access to their medication, they stay on it. It's every day, it's for the rest of their lives. So this isn't, it doesn't come and go, but the adherence to treatment is like we've seen it directly linked to making sure that people are housed, whether people are using or not, making sure that they've got that housing and basic needs met so that they can start to make those other decisions and they've got the support to do it. We don't expect people coming straight out of jail to consider HIV as their top priority because we can't. That's not reasonable. Basic
Right.
needs aren't met if they're not safe, if they're not, if none of those basic needs are met, we definitely don't expect people, it's not reasonable to expect people to think about, these like higher level medical issues that they have that aren't really affecting their day to day when they've just gotten out of, they've been released and they've got nothing and they've got no one.
Right.
And the stigma really where we see the most power is people working directly with these populations being able to talk about it and help with the destigmatizing, just like we had to with drug use and overdose reversals and all of it. It's the same thing because it's not going to go away. We know
Right.
that.
Right. Right. Well,
Oh, real quick, I have a survey that I'm trying to get out for the reentry specialists. It's for them to give to their clients. Would I be able to send the link and the flyer in the chat?
Yeah, and if you want, Tasha, I'll send it out in an email with some more information about this if we want to pass it on to the
Yeah,
rest
you
of
can either drop it in the chat, or Brooke, you can email it to me. I just sent you an email, but
Okay, great.
email it to me and I can get it sent out if you want it just to this council or if you want it statewide. You just tell me.
Oh, yeah,
Statewide would be
definitely
awesome.
statewide.
It's a statewide working plan.
All right.
So
Okay.
that would be great.
Yeah, I got your email, Krisha. So I'll just respond to your email and send you the stuff.
Perfect.
Thank you so much. And yeah, if anyone wants to come and check out one of the meetings, then I've got one at 1:00 and Tasha's got one. Tasha and Cassie have one at the end of the month.
very good. Yeah, I just saved the chat and for myself, and I think I really appreciate your coming on, Brooke and Tasha and Cassie. I appreciate the information. I learned quite a bit, and some of which I think can be very helpful. I think now I have another question to ask because when I'm talking to individuals, I need to get as much information as I can from them. And then I convey that information to these places that might be able to help them. And so now I need to ask them if they have been diagnosed or tested for.
When's the last time you got tested? Yeah. Do you know what your risk factors are? Is it something that you've thought about?
Okay.
And you can say this opens up some different resources for you, so they will be more truthful and
Right.
upcoming. You know what I'm saying?
So you ask if they have been tested,
Yeah.
or if they know, and how would they know their risk factors?
If they have a history or current use of IV drugs and like IV drug use and unprotected sex. If there's
Okay.
any
Honestly,
sharing.
it's especially in Cabell County or Kanawha County with the using drugs. So
Okay.
if you're from Cabell County, be like, hey, I know you struggled a little bit. Did you use IV drugs? Because there is an extreme risk factor for HIV, and then
Okay.
you're good to go.
Okay. That's important to know. I appreciate that. Yeah. And I think one of the things that I'm thinking of, and Chris, I think this might be something that, I'd like to get your thoughts on, but I think we've talked about it, but I think it would be good to maybe have a meeting, that goes into the Getting Out app. Because
That would be awesome.
it sounds like you need to be more knowledgeable about that. There are several people that I know that have talked to me that, they say, well, how does that work, and so on and so forth. So I know there are others who have expressed an interest in knowing about it. So um, I'm thinking we're going to try to uh, make available a month in which we can talk about that. And, we'll let you guys know, because it sounds like that's something that would really be helpful for you all.
That would
And
be great.
and it is a little tricky. I'm not, it's not, it's an app that, even, there are times in which it drives me crazy, because, I'm trying to put money on my account, and, and then trying to have video calls.
Mhm.
That's I mean, it's not that easy sometimes. But in any case, it's a good app. There is some nuances to it and intricacies to it, but once you get into it and start, navigating it, you'll find it gets easier. And so I think we're going to make some time to do that.
Awesome. That
We
would be
can do
great.
that, and it's like any technology, it's great until it doesn't work. So it does seem to have a lot of bugs that, I'll try to log in, and there's, different error messages all the time, but it's usually resolved fairly quickly. But yeah, when we decide we can do that, I can have, one of our navigators come and do the presentation, because they use it daily, and they use
Awesome.
the video portion, they use the phone call portion, they use the text portion. So we can have, and then there is a way, Brooke, also, if several of you want to share the account. So like ours for the reach is in my name, but Heather, Wes, Terry, Amber, everyone has access to it. So we add money once instead of having all of those separate. So,
Right.
Great.
yeah.
Right.
That would be great.
Well,
And
Christian,
even if any navigators want training on just how to facilitate conversations like this, we would absolutely love to. We do it all the time for all kinds of different groups. So we'd love
Yeah,
to.
and I think that would be great too, because we have the community healthcare worker going in
Yes.
the
Yeah.
Logan area.
Definitely. That
I
would be
think It
great.
would be great for
Okay.
so yeah, we'll get you with Amber. Well,
Thank
you've met Amber, yeah,
I know Amber. Yeah,
yeah.
she's great.
well, let me, Christian, can I, we have June is open right now. I have somebody for April, May, and July. Um, and I can also assist in that, but if you've got somebody on staff that is working with it as frequently as I am, then, I can assist, but if that person a navigator can come in and kind of take the lead on that. And, I think if make June available to do that, and then and I know other people that are in the same boat that Brooke is in. I've talked to a few that they've asked me, can I contact someone? And and they give me the booking number. You have to know the booking number, and it's an easy, once you have that, you can plug it in, and it's a nationwide search. You can find, and then if you know the booking number, you can find anyone in West Virginia and so forth. So I think it would be good, Christian, if we could maybe set aside June
Mhm.
and maybe talk to a navigator. And I just know that there's an interest there.
I'm on it.
I got to run. I appreciate you so much.
But we got to all run.
Thank you for having us. Thank
Thank you,
you.
Brooke,
Okay.
Tasha, and Cassie.
Yeah.
We appreciate it very much.
Thank
Yeah, thanks for
you.
having us.
You.
Sam, I got your information, and I may be talking to you. I got to try to sort out some other stuff, but um, I'm going to be talking to Danica Brown. I want to get a list of all of the facilities that are WVAR certified and that are also OFLAG certified. And you
Yeah.
said you are um, by both of these
Yeah.
organizations, and that's extremely important.
Yeah.
But I know, you're not taking sex offenders, and some of the people I'm dealing with, that's the offenses that they have. and that's the
Yeah,
most difficult population to help. So,
yeah, it is.
but
I
I
know,
do have some that's not the issue. So,
I know Shillian Circle of Care. Have you heard of them?
well, that's the facility that I
Thanks
was
for right to
I
another
had.
one. Bye, everybody.
We'll see you,
Thank
Kristen.
you.
Thank you. Sam,
Uh,
that's the facility that I try to get help for, and they approved one of these individuals, and then I just found out that they're not. Well, I don't know why. I haven't found that out, but they told me that they won't accept it.
I don't know. I know that a lot of people with like sex, like offenses, go there. You know, they house those guys. So,
Well,
uh,
it might be that they I don't know how they can be on. Well, anyway, all I know is um, the circle of care accepted this one individual. I sent the letter to the prison, and I just got off the phone with them about an hour and a half ago, and they said, "Well, we can't accept that place." And I said, "Why?" And they couldn't tell me. And they said, "Well, you have to talk to." We've been told we can't accept that place. So
hmm.
they gave me the number of their housing coordinator. So I'm going to call, well, that person happens to be a member of my church. Um, so I'm going to call and find out why. I have a suspicion that it's because they're not OFLAC certified.
I
Um,
know the director over there. His name's
Linda Porter.
or it's Circle of Care.
Right.
Well, I think he is. He said he was. Dusty Ladia.
No, that doesn't sound familiar. I think the owner, the one that I talked to there was Linda Porter.
Oh, okay.
I didn't talk to anyone else, and I think she might be the owner or the CEO or something. She told me she's a CEO.
Oh, okay.
Um, so yeah, I'm going to call Danica here just in a few minutes and find out why Circle of Care is not accepted. And it could very well be that the prison coordinator, the reentry coordinator at the prison, is mistaken, because I've run into that. Um,
Yeah,
I've run
yeah,
into that, and they think this, and in fact, it ends up not being true. Uh,
yeah.
so I want to double check and make sure.
I heard. I saw one of the guys that runs the place the other day at the town center mall, and he said that they got 90 some guys in there right now, and
At
they get a
Circle
lot
of
of,
Care,
yeah,
yeah.
and they get a lot of referrals from the jails and prisons. So, uh, yeah, I'm not sure why they would say he couldn't, unless he's already been there before, maybe, and didn't
No, they
work.
don't.
I'm not.
No, it's going to have to be because they're not OFLAC certified. That's because the parole officer told me that it has to be long term, at least 6 months. Well, that they're given 6 to 12 months, and so that's not the issue. So what is the issue? Maybe they've had some bad experiences, but if you're OFLAC certified, there should be no issue.
I mean, I have, I mean, heard uh some negative things about that place. Just, but not in really details. I've just have asked about. Had just said, maybe try to refer somewhere else or whatever. But
Okay.
uh, I think their reputation might not be up to
Okay.
par, maybe. And
Okay.
I'm not sure why. That could be a reason why. If it was like a parole officer that said no, then it could just be maybe a reputation or something like that of the facility. That's the only other thing that I could think of. I mean, I guess they call the shots. They can say yes or no. So,
I'm going to find out. I'm going to give Danica Brown. I don't know if you know her. She's the housing coordinator for the Division of Corrections and Rehabilitation. She takes care of all the housing. So I'm going to find out, and I'll let you know. I got your information, and
and I'm on that GTL app and what's the other one? Put JPay for the prisons.
right.
Uh, and Secure. So I've got three of them, and I put money on there. So I don't know if they can search for me, they message me on there, the guys, if they need to reach out or anything. But
Uh,
uh,
the the getting the geo, I've got two of those three that you mentioned. I don't have that other one that you mentioned, but I do have um the getting out, and then the other one you said was the geo.
GTL,
Yeah,
oh GTL again, JPay,
no, I don't have that.
and then
But
there's a
yeah, but
Securus.
I have right now about $65 on my account.
Yeah,
Actually, I had a little more than 100, and it's whittled down just from text messages and video calls down to about $65. So, but that will last me for quite a while, believe me.
yeah,
But they have to have, I believe that they have to have some money. I have put money on their account. I can put money on my account, and I can put money on their account because sometimes they need to have money on their account
yeah,
as well. And some of them get money from their relatives. And like I said, I put some money on their account um, so that we can communicate.
yeah. I think JPay has an option. If you send a message, you can send a stamp. They call it a stamp. You can send a stamp back
Mhm.
with your letter so they can reply.
Okay. Yeah,
Yeah,
I've heard of JPEG, and but I don't think I've used it. I just have been fine. I'm fine with the other two. It
yeah,
seems
yeah,
to be fine with me, but I have heard of JPEG.
yeah, yeah. I haven't used the Securus, but there's a guy got been trying to been communicating with his I think his aunt, and she seems like a really nice lady and cares about the
Mhm.
kid that's in there. And I told her I finally got his booking number yesterday because
Mhm.
it wasn't listed on his mugshot. I don't know why,
Right.
and I needed that to be able to try to
Right.
get in contact with him. So she got that for me, and I'm like, oh,
Right.
I said there
Right.
he is. So
Yeah,
uh,
once you have the booking number, you're all set.
yeah,
Yeah.
yeah,
Yeah. Well,
yeah,
Sam, it's good talking to you. I'm going to call Danica here in just a little bit. I know her very well. I was actually saw her yesterday. She'll give me an idea of what's going on with Circle of Care, and because actually one of the inmates actually knew about the program before I even mentioned it.
yeah,
So they
uh,
they're familiar with they know what's going on. You know.
yeah. Oh yeah, yeah.
So
I'll notice that I'll get applications and like get three in a row, and then one will have that guy's name on it. The next one will have the other guy's name. And
yeah.
they're talking like, you know,
Yeah. Yeah, they know
uh,
each other and they know what's going on. Some of them are still in, and some of them just got out, and they somehow probably still communicate with one another. But this one guy knew about it, so
yeah,
and so I thought that was kind of curious. Caught me off guard a little bit.
yeah,
Um,
yeah.
but I'm gonna find out, and I'll let you know.
Uh,
You put your email in there?
yeah. I think it's at the top. I don't know where you got disconnected. If
No, I
uh,
got right now. I've got the let me double check the chat because I saved the chat, and yeah, I got yeah, well
let's see, I'll copy and paste as well.
yeah, because I don't think I have it. I got some comments that you made, but I don't see your contact information.
There you go. I'll put it back in the chat there at the bottom. I don't let me know if you see it there.
Yeah, I see it. It's at the bottom.
Yeah, I copy and paste it again.
Okay, I see it. I got your phone number and your email. Okay, I'll save this right now. Um, this system is yeah, there it is. Okay, I saved it. All right, I'll be in touch.
All
Appreciate
right,
talking to
nice,
you. All right.
yeah,
Talk
nice
to you.
talking to you as well.
You have a good
I'll
evening. Have a
see
good
you.
day. Bye.
You too. Thanks.